If you've ever wondered, is it possible to treat trigger points without causing too much pain, then this video is for you. Hi, I'm Aubrey Going, Director at Holistic College Dublin here in Ireland. And in this video, we're going to take a quick look at how to work trigger points. So with trigger points, you basically have an irritation or a sensitization on nerve endings. And there's two components to this. There's a sensory component, which is why the client registers pain. And there's a motor component that gives us the characteristic tight band within a muscle that we commonly associate with trigger points. That tight band is called a contracture because it's involuntary tensing rather than a concentric or isometric contraction of a muscle. So when we are looking for trigger points, we're looking for a tight band within a muscle. We'll find central muscle belly trigger points in the middle of that tight band. Now remember, if we're thinking of a muscle tendon unit, that can mislead us because some muscles have very long tendons. So really we're thinking halfway between muscle tendon junction and muscle tendon junction. If we can palpate those, we can find that halfway point. Another way of finding this is feel for the tight band and work your way along it. Because the point at which we'll find the trigger point feels a little bit like a thickest point in that band, like a little knot in a string. We can confirm this though because the client will report that as the most sensitive area when we do palpate the trigger point. Once we've identified the trigger point then, we want to rate it. If it's rating more than 4 out of 10 on a pain scale, this is the key to keeping it pain-free. If the client says it's a 5, a 6, or even a 7 or 8, we can press on that trigger point to the point that we elicit a mild response and then gently pump it. This is a powerful technique, surprisingly simple. That's its strength, because all you've got to do is compress to the point of mild stimulus and ease back. As we pump the tissue, we create a dynamic fluid exchange. So this helps to get oxygen into those tissues, getting rid of our ischemia, and it also helps to start shifting some of those metabolites out of those tissues and reducing the sensitivity of the nerve. Sometimes within as little as 10 seconds, more often 20 or 30 seconds, you'll find that after pumping the trigger point, when you go back to direct digital compression, the client will give you a much lower number on a pain scale. So typically they'll report it as being about 4 out of 10. Once we're at 3 or 4, we can hold that trigger point. So as we said, trigger points are kind of like irritated nerve endings. And there's going to be a couple of different ways that we can look at locating these trigger points. One is by being aware of the anatomy, particularly the surface anatomy, so we can gauge where the middle of the muscle is. The second one is going to be by palpating for taut bands, which is kind of my preferred method for finding trigger points. And then the other method that we have is a drag technique. But really what's going to help us to validate that we're in the right place is going to be the client's response, because trigger points do have a particular sensitivity, what Leon Chaito used to describe as an exquisite pain response. So we're going to take a look at posterior tibialis for Alison because it's a very predictable muscle to have trigger points in. So I'm going to bend the knee. And when we go to find posterior tib, we're really just going to curl around the back of the tibia, pressing into that space between the tibia and fibula, and we're looking along the length of the muscle. So normally in treatment, I would look for tight bands, which I can feel pretty quickly there. It's kind of twanging back and forth. And if I go to the center of the muscle, it's going to be about here. I'm going to palpate and see if I can find something there, Ali.
Yeah.
Scale of 1 to 10, what's the sensitivity like?
4.
About a 4, okay. So that's pretty good. If it was more than a 4, I would actually do some really simple but important preparation techniques. So if the client reports that it's 5 or 6 or even 7, it doesn't mean I can't work it. It just means I don't want to do the direct digital compression straight away. So what I would do is I would pump that tissue. So pumping is a great way of calming down the nervous system and hydrating the local tissue. So when I press here, I'm pressing firmly to the point that I really get down to some resistance within the muscle, and then I ease back. I don't let go fully. So I press in and I back off by maybe 20%, and I'm just kind of pulsing that pressure. It's so easy to do and yet hugely effective. And it means you no longer have to put your clients through excessive discomfort while working trigger points. So after I've pumped it for a few seconds, I'm going to give it a little bit of a stretch and press in again. How's that now, Ali?
2.
It's probably a 2. So we didn't need to, but it's a nice way to illustrate the benefits of pumping. So I'm going to hold, and how I know it's a trigger point is it should reduce in 10 seconds. This is called the 10-second test. So as I'm holding, the therapist will usually feel a slight softening in the tissue, and then maybe a second or two later, the client will experience a reduction in the sensation. The sensitivity will start to go down. How's that now, Ali?
Gone.
Gone completely. Good. I'm going to pump. It feels softer. The tissue texture has changed. And stretch. But I still feel there's another tight band a little bit deeper. If I move a fraction, how's that, Ali?
Yeah.
Another trigger point there? On a scale of 1 to 10?
3, 4.
3, 4. Let's just hold this one by comparison. It may not go down as quickly because we haven't pumped it. So the benefits of pumping in preparing trigger points is that it's going to reduce sensitivity, but it's also going to make the trigger point more responsive. It resolves more quickly and more completely. We're at about 10 seconds there. How's that, Ali?
Yeah, it's gone right down.
Gone right down, still there?
1.
Like a 1. Has it plateaued or is it continuing to decrease?
Continuing to decrease.
Continuing to decrease. Then I'm going to continue to hold. If it had plateaued, I'd be thinking, well, maybe there's another trigger point in the vicinity. How's that now?
Gone.
Gone. So now we can pump again to hydrate those tissues, get rid of that ischemia that causes a lot of that irritation on the nerves. And then stretch the tissue to release any local kind of fascial adhesion around that contracture. A contracture is what we palpate as the tight band. It is an involuntary tensing of that portion of the muscle. So contracture rather than muscle contraction. Okay, and that feels like it's softened up a lot. So remember, once you identify those trigger points, compress. If the pain is more than 4 out of 10, pump. If it's not, just hold. After 10 seconds, the pain should reduce or be gone. Once we've eliminated the trigger point, we're going to pump the tissues further and give a little stretch to release any contracture, any adhesion in the fascia around that contracture to get the trigger point fully resolved and stop it from reforming too quickly. Hope you enjoyed this video. Try those techniques out in your clients. Let us know how you get on in the comments and be sure to subscribe for more content like this. Thanks very much for watching.